mind. So I think it's a good idea.
Ghattas. I'm a physical therapist. For 16 years now. I'm a manual therapist as well, trained as a manual therapist and a women's health specialist. I got into physical therapy probably because of how much I love the human body and movement and sports and things as a kid. And eventually, as I learned physical therapy and started treating patients and seeing that, I realizing that I wasn't really only helping people get better from physical ailments. It really wasn't just about the physical. It was very much about the emotional, the mental, what people were putting in their mouths, and how food was affecting our treatment and our progressions, and whether or not people were getting better. So I started really, this was a passion actually before physical therapy school, into nutrition. So I started really digging deep into natural healing, nutrition, just took a ton of courses, read tons of books, and really started helping my patients with nutrition and consulting as well. I found now that I've been in practice, I have a practice in Huntington, I've had it for 10 years. I found that I do see a good amount of chronic pain patients, and that just means that people who are in pain for longer than 3 months, and who haven't gotten answers to their problems, or maybe they've been to many different practitioners and no one's really been able to sort of get to the real issue, what it is that's driving their problem. They come to me usually on multiple pharmaceutical medicines and sort of different procedures that have been done and still in pain. So in a person like that, where there's been a lot that's gone on and it's been years and years, there's a lot to be done. So I take a very holistic view. I have a very team approach. I have a different therapist on my team, and we do things a little differently. If I think that somebody can use some craniosacral therapy or myofascial release, I have a therapist who does that. So we're very holistic in the practice. And something that we've been seeing a lot of, and that's what today's about lately, is migraines and headaches. There's definitely, lots of our patients now are having more and more, incidents of migraines more often, lasting for longer, and there can be many different reasons for that. And I guess today my goal is to just maybe make you think of a couple of other reasons that we could be having migraines. Some maybe thinking out of the box of, hey, I've been doing the same thing, nothing's really changing, or I've been on this medicine, and actually, if I really think about it, my migraines have gotten worse. So what I'm explaining are things that I hear from patients. I hear from patients that I used to have migraines twice a week. I'm thinking of a person that I treat right now. Twice a week. I said, well, how often are you getting them now, and how long have you been on the medicine? And now he's at daily headaches, and since starting the pharmaceutical, they've gotten a little bit worse. So we know that that's not always the answer. It's not always the go-to. My goal today is to just kind of like open up your eyes and just show you and talk to you about a few different things that you can think about and do for yourselves in terms of headache relief. So a lot of the things that I'll talk about are things that I've tried. Everything that I talk about is something that I've never recommended anything I haven't either tried or tried on someone. So that's for sure. So I'm going to share my screen and show you my little presentation. Okay. Can everyone see that? Okay. So we do have a chat, and if you guys have anything to say, definitely put it into the chat. If you have any questions, if you need me to clarify it, at the end, I ask them to keep the video on a little longer, and I go through the chat and I, get back to whoever needed me to get back to them. And we can also ask questions at the end, but okay. So let me get started. So this is us. This is Universus Physical Therapy. We Today we're talking about why, so much of what you've tried maybe has not worked, and what we can do to change that potentially. So a little bit about Universus. It's a physical therapy practice as well as a wellness studio. We help people age 40 plus stay active, healthy, and mobile. That's really, I say 40 plus, and we treat all ages, but that's really our specialty. We really love helping people who have tried a lot of different things to stay active and healthy as long as possible. Our mission is to empower people with chronic pain to break free from a life of fear and dependence and thrive in everything that you do. So we do emphasize having a comprehensive solution to pain in order to give you that confidence to get back to doing what you want. And it's always about you. It's always about the person. It's always, what is going on with you? What is your goal? Let's design this program around you. So the program itself is super individualized. It's nothing cookie cutter that we, find in a file and apply to you. And overall, my goal is to raise the standard in healthcare through education and focused support. And that's why I'm here educating all you guys. It's something that I feel very passionately about, and I, have a lot to say. So I figured, thanks for listening. So our why, so helping people, this is our philosophy, is that helping people recover from injury is not enough. We want to see people thrive in their mind and body. We want to make a difference in the lives of our patients in a way that's meaningful, and also makes an impact in the community in order to age gracefully and reduce suffering. We recognize that aging gracefully is multifaceted and requires a real holistic approach, and that is exactly what we do. We believe that building resiliency is the best way to thrive in the face of injury, stress, adversity, and trauma. So, actually, before I get into the whole thing, how is everybody? Does anybody have how's everybody doing today? Does anybody want to write into the chat?
I'm doing great.
You're doing great. Oh, cool. What's your name?
Karen Shea?
Hi, thanks for coming.
You too, thanks.
I really love doing these things in person. If you guys can put on your cameras, I'd love to see your faces because it's just so much more fun. But but we'll settle with virtual for now, but I'd love to see people in person someday. Okay, good. Anybody else want to shout something out before we get into the nitty and gritty?
I've had a migraine for like 5 days already. So,
oh my God.
Yeah.
I hope my lecture doesn't make it worse.
Thank you for doing this.
You're welcome. Oh my gosh, that stinks. I'm so sorry. All right, so let's see, I'm sorry. Here we go. Okay, so guys, let's talk a little bit on statistics. 18% of women, 6% of men suffer from migraines. Worldwide, it's a 10% prevalence. That's a lot of people. 3% of these people have chronic migraines, meaning more than 3 months, and very, very frequent and lasting a long time. 48% of migraine sufferers report 1 to 4 episodes a month, and half of these people say that migraines are severe and debilitating. That is really going to affect our quality of life and the way we feel daily about everything we do, really. Migraine pain reduced health quality, but more than osteoarthritis or just arthritis and diabetes did, which is significant. The cost to the U.S. economy is more than $1 billion in lost time of work and productivity, because, as you know, I'm sure if you've had a horrible headache or migraine, it's not easy to work through that. Okay. All right, so here's some myths. That the pain is only in your head. So by head, I mean the cranium, the face and cranium. The neck is very often involved, and a lot of times the neck is referring a headache because of the neck dysfunction. I'll talk to you guys more about that later, but that you're having, another myth would be that you're having migraines only because you're stressed. I absolutely think that stress makes things worse and exacerbates what's already going on. But focusing on the fact that you're stressed will make you even more stressed. So we have to find ways to sort of reduce our triggers, increase our threshold to get us to a point where we can tolerate the daily stresses of life, because stress is not going anywhere. I'm sure you guys have realized that already. The stress is not going anywhere. It's here. It's all around us. We sort of have to deal with it. So the best way that I can help you is not to say don't be so stressed. It's to say, how can I make your body more resilient and strong in order to tolerate that stress? The myth would be that migraines are only a vascular problem, and that just isn't true. There's a lot of people treating migraines to reduce vascular sort of swelling, or in the vessels of the head that they swell. There are mechanical reasons for migraines as well, and I'm definitely going to get into that with you guys today. Another myth is that you can have a lasting relief for migraines with pharmaceutical meds. I have to tell you, most people who actually resolve their migraines couldn't do it without lifestyle modifications, and that includes sleeping enough, eating properly, taking care of your body. So, and that's some of the stuff I'm going to talk about today. So how does an MD diagnose a migraine? Right, so you go to the doctor. Maybe it's your primary care doctor. Typically, if you're complaining of ongoing headaches, you might be going to the primary care doctor first, who will maybe refer you to a neurologist if it's that severe. But I have to tell you that the diagnosis of migraine is made based off of your symptoms. So what I mean by that is you go into the doctor's office and you tell them how you feel. I have pain here. It's throbbing. It's on one side. It hurts when I bend my head. It hurts when I get up out of bed. You describe it to them, and that is your diagnosis based on your description of your pain. So then the diagnosis based on what you told the doctor dictates the treatment. So then you're going to be given a treatment based on what you told the doctor. There aren't any clinical tests to tell us whether you have a migraine or not, for sure. So there's really nothing on an X-ray that we can point to and say, oh, they have a migraine, or that's yes, that indicates a migraine, or there's nothing on an MRI, or there's no real specific lab tests. There are general lab tests that we can take that would say, oh, okay, yeah, their CRP, their inflammatory marker is elevated. So yeah, that makes sense that they have a migraine, but inflammatory marker can be elevated for so many different reasons. Autoimmune disease, just being sick, like there's so many different reasons your inflammatory marker could be elevated. So there's not a real definitive test that you can do to decide if someone has a migraine. So the problem with that is that people can kind of like explain, like it's very difficult to feel what you're feeling when you're feeling it, or to be able to describe to the doctor what you felt a few days ago or what you've been feeling. So it's kind of tricky to me that we only diagnose a migraine based on symptoms, what the patient told the doctor. So I think, well, and I know that the best way to help patients figure out the cause of their migraines is to put our hands on them. And that typically in a typical, doctor setting doesn't happen. No one's really going to put their hands on you and feel around and see if anything's out of alignment, to see if there's possibly another cause for your headaches. So if you're describing your headache and it comes out that it manifests something like what we have here, I describe the difference between a headache and a migraine. There are a lot of different types of headaches, and a migraine is one type of headache. It's a recurrent headache disorder manifesting in attacks lasting 4 to 72 hours. It's usually on one side, unilateral. It usually has a pulsing quality. It's moderate to severe in intensity to be called a migraine. And it's also associated typically with nausea, vomiting, light sensitivity, or sound sensitivity. It can also come with a visual disturbance or an aura. So if you have described some, there's certain criteria, okay, so they have to check their, migraine criteria book, and they have to see, do they have 2 of these? Do they have 3 of these? And if you fit these specific criteria, you get diagnosed as a migraine sufferer. So again, the issue for me is that no one's put their hands on you yet. So you get prescribed a medicine potentially based on what you've told them. So we don't know if maybe there is something going on at the neck that we could solve that could potentially alleviate the migraine, instead of going the medicine route first. It's always, you want to try to aim to go the natural, least invasive way first. So here are some other types of headaches. The primary headaches. So primary and secondary headaches. A primary headache is that the migraine is the primary issue. It's not due to another disorder. Meaning that, there's nothing causing the migraine that we know of, like an infection. If you were sick, you'd have a headache, a trauma, an injury. That's obvious. Like you were injured or you had trauma, there's a headache. We're not going to label it, we labeled it a secondary headache. The person came in with a headache, but it was due to something obvious and specific. The vascular disorder, stroke, even a hangover. I mean, we know exactly why it's there. So primary headaches are that it's not due to any other disorder. There's migraines with or without aura. And then there are these other types of headaches that I treat a lot, because it has to do with the neck. And obviously I work on the spine and the whole body, but the neck is, I work on the neck a lot. That there are tension type headaches, also known as cervicogenic headaches, that these headaches originate from the neck. There's trigeminal neuralgia. These are just a few. There are so many. Trigeminal neuralgia is a nerve that comes out of the brain and actually goes and innervates parts of the face. So if there's anything going wrong with the trigeminal nerve, you can have facial pain or headache type, kind of like a side headache type of a thing. Can even have ringing in the ears. So trigeminal nerve actually runs very close proximity to C2 vertebra in the neck. So I have a lot of times been able to figure out that the C2 level, C2-3 was the issue, fix that, and then the trigeminal neuralgia, depending on how long it was there, will get much better, if not completely alleviated. But again, a rarely chronic trigeminal neuralgia, it is a nerve, and nerves don't like to be compressed for a very long time. They get very, very angry, and it's very difficult to, get that feeling back or lose that pain sensation. It's been a very, very long time. Occipital neuralgia, same thing. You have nerves that run in the occiput here in the back of the head, the base of the head, and it innervates or sends messages, pain messages to the back of the head. So that back of the head, pain could be because of occipital neuralgia, which again, some of the neck treatments can really help with. So, the medical doctor's goal is to reduce frequency of attacks so that you don't have as many, improve your response to medication in an acute attack, and to overall improve quality of life and reduce disability. It's a reduction and improvement of things, but typically it's not sort of with lacking a sort of a hands-on assessment. It's not really that we don't know for sure what the source of the problem is. So this is I just put this in here because I know, a lot of migraine sufferers are on, and the headache, the pain is excruciating sometimes, and just can't do it without the meds. And it's totally understandable when that pain comes on. I mean, it's horrible. So the medicine is there for that. But just so you guys, are aware, especially if you're like new to migraines or you're considering medicine, you might want to think about it, because triptans are, they're prescribed for infrequent use. They're supposed to be for acute severe headaches, and they're actually not supposed to be used more than 2 days a month, or it can lead to rebounds. And I'll explain what rebound is, but it basically just means that the headaches get worse over time. Opioids, again, codeine, oxycodone, a lot of people use these things for headaches. They're highly addictive, and they also cause rebound. Preventatives, you know, if you need a preventative, that's totally fine. Like some people have high blood pressure, which that's, you know, that's going to be considered then a preventative for headaches. Acetaminophen, ibuprofen, aspirin. These also are, they're fine to take infrequently, but more than 2 times a week, it can start to cause some issues in the liver, the stomach, causing IBS over time, leaky gut, kidney problems. So, I mean, nothing is without a price. So I like to make people aware, you know, that you've, and just sort of open your eyes to say, you know, have you exhausted every natural option, right, before going to the meds? Because they are chemicals and they are going to have an effect in the body. So what is rebound vasodilation? This is when the migraine medicine constricts the vessels to give you relief. So it makes the swelling go down, makes the headache go away. But when the drug wears off, it actually, those vessels respond by swelling even more than before. So, you know, it's not the best. So if we can keep those medicines used at a minimum so that we can mitigate this event from happening, I hope potentially stop this event from happening, if you just infrequently try and use those medicines and do some of the things that I'm going to suggest in a little bit. So what is the number one overlooked cause of migraine or headaches? Does anybody know? You probably already figured it out by how many times I said it. Does anybody know? Water, dehydration. Yeah, definitely dehydration will cause headaches for sure. That's how I get my headaches. So actually, the number one cause is, right, is that going? Hang on, guys. Okay. An underlying neck issue. So 90 to 95% of people with migraine headaches have a restriction in the upper cervical spine, meaning the neck vertebra that live closest to the head, right beneath the head. There's cervical vertebra number 1, 2, 3, 4, 5, 6, 7. So the neck can refer pain to the head and the face, both the head and the face. So it's definitely a likely culprit. We see it a lot. The thing is that it's really hard to diagnose because an X-ray and an MRI will not show the type of problem in the neck that we talk about or help with when we're looking at migraines. So I'm looking for like a movement dysfunction. I want to see, does this vertebra turn right? Does it turn left? Does it go side bend right and left? Can it turn? Can it look up and down? So I physically have to feel it with my hands. And on an X-ray, you know, if your X-ray is fairly clean, like you're, you know, fairly young and you don't have a lot of problems and there's minimal arthritis, they'll just say, oh, it's minimal arthritis. It's great for your age, no problem. So it's not your neck. But it's not picking up on the movement deficiencies that we often find with our hands. So that's the issue with, you know, looking at an X-ray and MRI to try to figure out if the migraine problem is from your neck. You know, and neck is overlooked for many, many reasons. I have people who, you know, reported a car accident years ago. I mean, years and years and years ago. So it was like, yes, their neck hurt and was a problem back then, but they wouldn't normally relate the pain today of the migraine to that, you know, that accident that you had, you know, however many years ago. But car accidents, trauma to the neck causes like real lasting chain like problems, right? So if, you know, those problems don't really get fixed with a hands-on, you know, approach to loosening all those joints up, sometimes your body adapts. The muscles start to use other muscles for things. You start to have like, you know, different kind of compensations to get away from the problem. And it almost can look like you don't really even have any loss of range of motion. And, you know, most MDs, unfortunately, like they're doing 100,000 other things. So they're not really going to do a movement assessment with the hands of the neck, which obviously, I mean, that they would just, you know, refer them to a PT or a chiropractor. So I just wanted to show you guys a picture of where these are the cervical dermatomes. It's a dermatomal map. So it just shows like in a map sort of where those cervical levels in the neck refer pain. So here's C2 right back of the head. C3 is the back of the neck. So is C4 and C5. So certainly if there's dysfunction in those parts of the neck that we can, have some of those pain issues, and it can feel very much like a typical migraine, but it's something that's potentially from the neck. So I just wanted to give you guys some tips and some ways to really help yourselves. I want to talk to you about what it means, a trigger level and a threshold level, what that means. So trigger level is really the primary determinant of migraine activity. The amount of trigger that you have will dictate if you have a migraine. And that varies from person to person. Everybody's very, very different when it comes to that. The secondary determinant of a migraine would be your threshold level. So sort of threshold is like your tolerance level. How much pain can you tolerate? Like, or how much, stress and strain can the system tolerate, or you? So this threshold can be hereditary. Sometimes in families we see that they have similar thresholds for pain and for migraine. But if the total trigger level goes above the threshold, above what you could tolerate, then the mechanism of migraine is activated. And it's very difficult, as you know, to unactivate it. So I'm going to talk to you a little bit about the key to controlling headaches and migraine. So obviously, one of two things or both, right? Either reduce your triggers, increase your thresholds, or even better, do both. Okay, so I'm going to talk to you about what some triggers are, and I'll talk to you about how to increase your thresholds, and you're welcome to do both, because if you did both, I'm sure you'd see some sort of results. At least, something would give. I can almost guarantee it. I won't guarantee it. So some dietary triggers would be caffeine, and believe me, I am not suggesting to not drink coffee, because I love coffee and I would never do that to you guys. But drinking too much coffee can trigger headaches over time. It's happened to me. I've pushed the limit. So there is like an upper limit of coffee. So you could be over consuming coffee and causing your headaches. Chocolate also, because of the caffeine, the MSG in certain foods, processed meats, fish, alcohol, aspartame, definitely in a lot of like those mixed kind of lemonades and stuff, soy. A lot of these things are triggers for migraines. So be aware of reactive hypoglycemia. This is when the blood sugar levels drop so drastically that shift is going to trigger a headache, and it can happen pretty quickly. People who are trying to eat less in order to lose weight typically will start to trigger headaches. So you have to, if you are actively trying to lose weight, you have to be really intentional and really careful about your food, your calories in, calories out, because if you're constantly in a deficit and you become hypoglycemic, or if your meal times are very erratic, or there's big gaps of time between meals, that can cause a reactive hypoglycemia. So you want to be really aware of spacing your meals at like regular intervals, like breakfast, lunch, and dinner. Breakfast at 7 to 9, lunch 11 to 1, and dinner 5 to 7, whatever. But that they're spaced out. Skipping meals for people with migraines is really always a problem. And so trying to eat smaller meals, more protein, carbohydrates, fiber, those are very, very good ways of kind of keeping your blood sugar levels steady. Obviously, stress is a big trigger, but we've said that, it's not really going anywhere. So, I mean, obviously, if you can reduce your stress, if you know there's just one person that has got to go, they might just have to go. But sleep deprivation is definitely huge.
I can't tell you how, I mean, don't even get me started on sleep deprivation, because you can't even really heal from injuries, from trauma, if you're sleep deprived. All the healing happens in sleep, during sleep. If certain chemicals don't get released, I mean, it's going to really mess up your circadian rhythm and really mess up your ability at being able to heal from things. So if you're in rehab, you're already in PT or something, and you're not sleeping, it's like you feel like you're going to spin your wheels because the healing is so slow or just not happening sometimes. So, and some prescription meds can directly stimulate the migraine control center, and you can experience headaches even months after starting that medicine. We see that a lot. So you just want to make sure that the medicine you're taking for the migraine is absolutely, or I'm sorry, just make sure that any of the medicines that you're taking are absolutely necessary for your health, and there's no other way to improve your health to potentially not be able to take that. Potential migraine causing meds would be birth control, hormone replacement therapy, Ritalin, diet pills, Viagra, Prozac, Cymbalta, Wellbutrin. A lot of the anxiety and depression meds do cause headaches. And there's a lot to be said for raising your threshold, which will in turn help some of the anxiety and depression. I mean, actually a lot. So anyway, I'll talk to you guys about that next. So here are some ways to raise your threshold. Again, so you can always ask your neurologist about preventative meds if you have severe migraines. A lot of my patients have had to, kind of stay on the preventatives, which is totally fine. I mean, I have no issues with them. So exercise, regular exercise done regularly, 3 to 4 times a week for 30 minutes each time. I mean, that's definitely the recommendation to maintain at least, good health, right? Eating non-inflammatory foods is very important. You can try supplements. You can try magnesium oxide for migraines, CoQ10, of course. Ask your doctor, clear it by your doctor. I'm not your doctor. I'm just saying that these are some things that do help. The magnesium oxide and the CoQ10 have been shown to help migraines. Vitamin C, D, zinc, and quercetin I just put on there because those are really good immune boosting supplements. So again, clear it with your doctor. Don't just take it without asking. Perform daily stretches of your neck and back muscles to keep them loose. That will increase your risk thresholds. I mean, like if you, a lot of times the muscles get tense and painful, but if they were stretched daily, you'd improve the threshold within the muscle. So that's really, really effective at keeping the headache frequency down. Keep your stress response low, your response to stress. Now, like, we can have a huge response to stress, we can have a mild, we can have a middle. Everybody's response to stress is very different. It's usually based on what's going on in your life, what other factors you have, but meditation does show that it can give you a better tolerance for responding to stress. Other examples of some triggers are hormones, sensory stimulus, loud music, things like this, barometric pressure, alcohol, I think I mentioned, the caffeine I mentioned. All right. So I have some tips for you guys. So number one, actually, this really is number one on the priority list. If you have migraines, like I said, you probably also have a neck problem. So do not sleep on your stomach. Actually, I really never recommend people sleep on their stomach who have pain, especially if you're waking up in pain. That's like a big indicator that it could be the way you're sleeping. So ways to get around this is to use body pillows, prop the pillow under the stomach and use it, sort of hug it and put it in between your legs so that you have the compression of the pillows giving you input on your stomach and chest as if you were on your stomach, but you're not, you're kind of like quarter turned. But you have that contact with the pillows. So it really tricks the body into thinking you're on your stomach. It really works. You could use a custom fit pillow. We measure people and frequently order pillows for them based on their measurements. Very, like a customized pillow. Make sure you get a full night's sleep. And we talked about sleep deprivation. Now, if you have real issues with sleeping, I would highly suggest you have a sleep assessment by a specialized doctor who does that. All right, so tip number 2 is to incorporate exercise routine into your life, right? Movement is medicine. I will never stop saying this. You got to get your heart rate up 3 to 4 times a week. Absolutely have to for good health, for just good health. Sometimes patients with migraines have more pain with exercise. So, you know, my goal is to keep people exercising. Ultimately, between you and me, that's my main goal in life, is to make sure people keep exercising, because I know all the benefits that exercise can give us. And I've tried to figure out many different ways so that that could happen. So I work with people where they are. If exercise hurts, we figure out what you can do that is considered exercise without it hurting. That's just what we do. That's what physical therapists do. We assess your movements and figure out what it is you can do and make sure you do that. So, you know, like sitting on a Peloton for a person with neck problem, or sitting on any bike, is usually going to make the neck worse, because you're having to usually go like this with the head and you're hyperextending at the neck for a prolonged time, usually on a bike. So, you know, biking might not be the best thing for you, even though you think, I love the bike and, you know, this is my form of exercise. You just might have to switch it up. Maybe you have to walk, just because then your neck can be in neutral. Overhead pressing with weights is not really great for migraines either. Now, that doesn't mean if you're a big bodybuilder, you want to lift weights, that doesn't mean you can never lift weights overhead. And it doesn't mean that you can never ride a bike. Absolutely not. It's just that we want to, if that's a trigger, right, we want to take away that trigger for the time that you're healing, get you doing other exercises that you may not love, but you're exercising, and then get you back to doing the thing you do love once everything's all fixed up and you're healed and feeling good. So increasing your heart rate can act as a natural analgesic to reduce pain. It really is natural medicine. So it actually has shown in studies to have the same effect as migraine medicine. So exercise is very, very important. Again, if you can't exercise because it hurts, it's imperative that you find out why that exercise hurts and fix that, or adjust it, or get some advice on that. So avoiding prolonged sitting. Sitting is the new cancer. Everybody's sitting. Everybody, you know, especially after what happens in the last 2 years. But it is causing this slow deterioration of our bodies. Our bodies crave movement so much so, like every part of every joint in your body, every ligament, every muscle, every organ is dependent on good blood flow. So if you're stagnant, if the blood is not flowing, these parts of your body, your joints, your ligaments, your muscles, your organs, they're just not gonna be optimally functioning. It's gonna be more difficult. It's just gonna make the whole system have to sort of struggle. So, you know, movement is the best thing for us, really. Keep moving, getting up around, get up a lot. You know, if you have to sit, obviously a lot of us have to sit for work. Get up a lot, turn the head. Even if you have to sit, turn your head left to right. Your head wants to move. Extend, you know, look up and down, go side to side every now and then, every 30 minutes or so. Stand up, sit back down if that's all you can handle, or easily job can tolerate, they can have you do. Extend your knees, straighten your knees, bend your knees, you know, extend your spine, curl it, side bend, twist in the chair, do a little movement. Just keep your body in. When I say movement, I don't mean you have to go walk, like, you know, if you can't, these little movements still count, is the point. Sometimes sitting and relaxing isn't the best thing for your neck. You know, like if you feel like you're resting, but your neck is sort of in a bad position for too long, that can exacerbate the neck problem and make it even more stiff and stuck and more painful. So just sort of like, even in your restful positions, be aware of where your head and neck is in space. You never want, you know, the head to be sort of too close to the ear, especially if you're sleeping in a pillow. That's why I was talking about the custom pillows are so great, because it measures exactly the space from your shoulder to your ear. And I've always said to people, you have to get a pillow that fills the space between the end of your shoulder and your ear. So that's, that's what we do with the custom pillows. We literally measure and it fills that space, because anything that you're having to do like this with your head, it's gonna compress the neck vertebra and potentially make the trigeminal neuralgia or occipital neuralgia even worse. So this is another biggie. I constantly talk about this one, changing your diet. I guess the question is, are you eating healthy things that will boost your immune system, right? Or are you consuming food that will cause your body to draw attention to the systemic inflammation, right? So there's only so many things our bodies can focus on, right? So is your body focusing on or having to deal with the inflammation that the food is causing? Because a lot of food, processed foods, lots of dairy, that sort of the not anything that's not whole foods, anything that's really like out of a bag or processed or with a lot of oils. Be really, really aware of the oils that are in even like the all natural chips. Those oils cause leaky gut. Those oils really just wreak havoc in the intestinal lining. So if you're consuming things that are creating systemic inflammation, nothing is fully swollen on you, but in your cells, there's inflammation. So your body has to deal with that. Your body is always in the act of sort of dealing with the inflammation that's in the body because of what we're consuming. But if the body was clean and the food was clean, it could just fully focus on healing whatever it is that you're dealing with. So that's why, eating the right things is so important. Eating the right types of foods will increase your thresholds and your tolerance for migraines. You can actually have a food sensitivity test to figure out which foods your body isn't tolerating well. There's actually a lot of different ways of doing that. There's blood tests. There's something called biofeedback, where you can figure out if you have food sensitivities. But again, dairy, carbohydrates, sugar for sure, typical triggers, and just being aware. And sugar doesn't always come in the form of candy and cake. It can just be too many carbohydrates that the body can't process. All that sugar turns to sugar in the body. So that's that about diet. So reducing stress and depression with meditation. There's a lot of studies out now about meditation. It's actually really exciting. That practicing mindful meditations helps to lower cortisol. Cortisol is the stress hormone that gets released into the bloodstream by the brain when there's emotional stress. So when there's too much cortisol in the body, we can't lose weight. We have those feelings of stress. We're in fight or flight. Our sympathetic nervous system is activated. That again, that's a lowering of the thresholds for your migraines. But doing meditation and getting your body to calm and getting your heart rate to lower, getting your blood pressure to lower with meditation, with just breathing, really just like close your eyes and breathe. That's really all mindful meditation is. So practicing this releases opioid-like chemicals that are powerful pain and stress relievers, just like the medicine, but no side effects. These chemicals that get released, these like opioid-like chemicals that get released into the brain from calming the brain, they're 18 to 33% stronger than morphine. I don't know how they figure that out, but I believe them. Sounds accurate. So another tip would be to have a movement assessment of your neck. You get to figure your neck has to carry around this 10 pounds, if not more sometimes, of weight of the head. So your neck has to be able to move freely, but also be strong enough to carry your head. So, a lot goes into it. So if we have to strengthen, we have to make sure it moves properly. Posture is something we look at all the time, because that your posture, even, what your lower spine is doing will affect the head. Because if you think of lower spine, mid spine, cervical spine, there are these blocks, right? If one of the blocks is doing something funky, even if it's at the lumbar spine, shifting back, shifting forward. All of the other, the blocks on top or the vertebra are going to have to respond in order to keep you upright. So fixing your posture from the feet, even. We look at, I mean, a neck patient, I look at their feet, I look at the way they walk, I look at the way they stand from all different directions. I'll put them on a, I have a scanner that looks for, we do custom orthotics. So the scanner can show me where you're putting your pressure, too much on the right, too much on the left. It can show me asymmetries. And these asymmetries are like the core of why people suffer for so long, because they're just really hard to find, right? And they just perpetuate, they go on and on. And if you don't really like fix the posture, you know, we have a lot of issues that don't go away. So manual therapy assessment, you look at how each vertebra moves in between the necks, the C2 and the 3 at the right, the C2, 3 on the left. We look at all of these things and we test and we look at movement. Yeah, so jaw and TMJ pain can also refer a headache. So if you have a TMJ problem, that even an old one that you know, maybe you have a mouth guard for nighttime, but if it's not sort of like fixed with that hands-on approach, I mean, I have a PT that does TMJ release, and we used to go in the mouth and, you know, release the jaw. So, and that's extremely helpful for headache relief as well. So I'm going to give you guys another, you know, tip would be try to do 3 things a day that are going to reverse your forward head posture, or that, you know, poor posturing, right? Can't give you guys specifics. I don't know you each on a personal level, but these exercises anybody can do, and they're going to be great for your neck and posture. So number 1, open your chest. So you want to think of the front of your chest that it's open, right? When we sit and we cave in and we put everything's forward, our head is forward, our chin is forward, our arms are forward, that puts a lot of strain on the back and then stretches those muscles that go all the way back into the head. So having a chest that's kind of caved in will cause a lot of headaches as well. So opening up the chest is really great. You can do it in a few different ways. You can get into a doorway stretch, hands at the door frame, step in, opens the chest, and just hold and breathe. You should feel pulling in the front of the chest. You could also do it on a foam roller. If you have a foam roller at home, you lie down, you could put for this stretch, you would put the foam roller vertically across the spine. You would lay on it, open your arms. Again, that would open the chest. I would recommend trying to hold for about 30 seconds, about 2 times a day. Strengthening your mid back, really great for, again, posture, because if my mid back is strong and active, I can sit up straight easier than without. So if my mid back is weak and I'm having trouble, you know, sitting up, that obviously doesn't help the posture. So strengthening your mid back is huge, crucial. So when you're sitting in your chair, wherever you are, squeeze your shoulder blades together for 10 seconds and do that 5 times, twice a day. I have to admit, I do it way more than twice a day. It's just an isometric contraction, you know, nothing bad can happen. So you can do it, you know, a few times, more than 2 times a day, where you're just holding the shoulder blades, squeezing the muscles there. So also twisting the spine. You can do it seated or on all fours. On all fours, you'd be like on an all fours position, raising one arm, twisting, threading it under, raising and threading. In sitting, you could also, if you can't get out of the chair, you can just twist your body over to one side, push off of your thigh to get yourself to twist. So really doing these exercises, and there's so many more, you know, again, like I just try to give general ones. I have to do an assessment to figure out what I would recommend for you. But doing these things regularly is the equivalent of taking vitamins for your spine, you know, keep your spine at the best chance of not hurting. But these are perfectly fine. Pretty much anybody can do these. If you have any questions about it, you can always reach out.